How does sleep apnea impact right heart function in pulmonary hypertension? Have you ever wondered how sleep apnea affects the heart, especially the right side? Let's break this down in a way that's easy to understand. Sleep apnea, particularly obstructive sleep apnea, involves repeated pauses in breathing during sleep. This leads to low oxygen levels, a condition known as hypoxia. When oxygen levels drop, it can have serious effects on the heart, particularly the right ventricle, which pumps blood to the lungs. In pulmonary hypertension, the blood pressure in the arteries of the lungs is higher than normal. This condition puts extra strain on the right ventricle, making it work harder to pump blood through narrowed or stiffened pulmonary arteries. Sleep apnea worsens this situation in several ways. First, during episodes of apnea, the drop in oxygen causes the small arteries in the lungs to constrict. This process is called pulmonary vasoconstriction, which increases the pressure in the pulmonary arteries. As a result, the right ventricle has to work even harder, worsening pulmonary hypertension. Next, sleep apnea can impair the function of the right ventricle. Research shows that this condition can affect how well the right ventricle contracts when pumping blood. Over time, the right ventricle may undergo structural changes, such as thickening of the walls, known as hypertrophy. These changes can lead to right heart dysfunction and, if not treated, heart failure. Additionally, sleep apnea causes repeated surges in sympathetic nervous system activity. This increases both systemic blood pressure and heart rate, adding more stress to the right heart. There is a strong connection between sleep apnea and pulmonary hypertension. Many patients with pulmonary hypertension also have sleep apnea, and the presence of sleep apnea can make pulmonary hypertension worse. While some studies show that patients with sleep apnea have right ventricular hypertrophy and reduced function, others find no significant differences when accounting for factors like obesity or lung disease. However, it is clear that sleep apnea contributes to right ventricular dysfunction independently of other risk factors. Recognizing and treating sleep apnea in patients with pulmonary hypertension is essential for reducing strain on the right heart. Treatments like continuous positive airway pressure therapy can improve oxygen levels during sleep, lower pulmonary artery pressures, and help maintain right ventricular function. In practical terms, addressing sleep apnea can slow down the progression of right heart dysfunction in pulmonary hypertension. Sleep apnea impacts right heart function primarily through hypoxia-induced pulmonary vasoconstriction, leading to increased pressure in the pulmonary arteries and impairing the right ventricle's ability to pump effectively. Taking steps to manage sleep apnea is a key part of maintaining heart health for those with pulmonary hypertension.